I understand the motherly instinct is to lay down your life for your children, and you always sacrifice yourself for your children. The concept of optimal health that I would share is that if you never take care of yourself, there's a chance that you might not be there for your kid. You might not be showing up the way you need to show up for your kids, to be that role model, to be that leader in their life, right? And so optimal health to me is being the best that you can be with the tools and the resources that you can muster up and that you can find. And most people need to understand that the Western medical model that's available to us today is not doing us any favors. And you go to the doctor and you do your annual and you get lab work done, you may be feeling anxious, moody, irritable, depressed. Women may have issues going on with their monthly cycles. There's all kinds of things that be going on. But as we age, we accept those things as being a normal aspect of aging. I'm not 30 anymore. I'm not 40 anymore, or whatever. I'm getting older. Right. And so bodily dysfunctions seem to be just accepted as the normal process of aging. And so to me, optimal health is that you feel good in your skin. You feel good in your body. It feels good to be you. You sleep well at night. You have natural energy when you wake up in the morning. You have the mental clarity and the focus to do the things that you need to do in a day. And it just feels good being you. And so being the best version of yourself that you can possibly be. And yes, it starts in the mind. Mindset is critical. We can be pessimists. We can be optimists. We have to be realists to a degree as well. But sometimes there's a true physiological imbalance that could be causing the inability to transform the mindset.
Yeah.
Right?
Yes.
That's what I address a lot of times is the holistic nature of body, mind, and spirit. But sometimes we need a little bit of help in the physical plane to help us actually feel better so that we can focus better, so that we can choose that mental mindset instead of falling into the negative.
Okay, thank you. And you mentioned hormones before. Can you explain what role it plays in our optimal health?
Yeah, so I like to say you are your hormones. I ask a question in my live audiences all the time. I say, do we age because we lose our hormones, or do we lose our hormones because we age? For women, very specifically, women feel their hormones even more than men do. So women, I'll give you an example, can lose up to 50% of their testosterone production between the ages of 20 and 40. And it's usually tied to a couple pregnancy cycles. And what happens is the ovaries age from the inside out. And in the inner core of the ovary, you produce testosterone. And then on the ring around that, you produce progesterone. And on the outside ring of that, you produce estrogen. And so menopause is defined as when you don't have a cycle for at least 12 months in a row. And it's the absence of estrogen. So that usually happens between 48 and 52 years old is the average time of menopause. Some women can have early onset menopause as early as 35 or 40 years old, but most women will experience that somewhere between, let's say, 47 and 55, right? Okay. And as you age, let's say you go from your 20s into your 30s and maybe you have a couple children, a lot of women have shared with me that they feel their absolute best when they were pregnant. Now, there's an exception to that also. Some women felt completely miserable their entire pregnancy, but a lot of them share that their hair was good, their skin was good, they looked radiant when they were pregnant, and then as soon as they gave birth, their hormones come crashing down. And from that point on, they never really felt like themselves again. And then you have a second child, maybe you have a third child, and the whole hormone roller coaster happens again. So what I teach on is hormonal balance. Meaning there are ranges, and what people need to understand is when you go to the doctor and you get your lab work done, that although your blood work is in the normal range, it may not be optimal. And I want to give you an example of this. Many, many women suffer from what we call hypothyroid symptoms. Mm-hmm. And maybe you've been on Dr. Google and you can check out what we mean by hypothyroid symptoms, but there's 120 symptoms associated with hypothyroidism.
Wow.
That could be anything from losing your hair, cold hands, cold feet, unexplainable weight gain, moodiness, irritability, lethargy, just amazing amount of symptoms that are tied to your thyroid not being optimal. And what happens is you go to the doctor, they only do it what they call a TSH test and a T4 test. And in most cases, that test will come back in the normal range. And what they're failing to test for is something called free T3. Free T3 is the active thyroid hormone that actually works at the cellular level, but they don't normally test that. And that's the whole story that I probably don't have time to explain, but women need to know that they feel their thyroid. And thyroid is that hormone that's responsible for all the metabolic functions. The idea of gaining weight or losing weight, getting exercise again and getting fit again like you were maybe before you had some babies, right, is very much related to thyroid. And because we took iodine out of our food supply back in 1972, the human body needs iodine to create thyroid hormone. And when we're deficient in iodine, we don't make thyroid hormone. And as we age, we also lose some of the enzymes that convert one thyroid hormone into another one that we desperately need. So as you can see, it's kind of complex, and I'm keeping it kind of simple, but the key is to find a physician or to find a doctor that actually understands these things and won't just look at your lab work and say, oh, you're normal, and maybe you're just depressed, and so I'm going to write you a prescription for Prozac. I can guarantee you that you don't have a Prozac deficiency.
Right.
If you don't sleep at night, you don't have an Ambien deficiency. You don't have a Wellbutrin deficiency. You don't have a Nexium deficiency. You don't have an antacid deficiency. Every single symptom that we both as men and women have can be diagnosed or the root cause determined to be either a hormonal imbalance or a nutritional deficiency or imbalance. But it takes a skilled practitioner and a skilled doctor, that has gone through extra training to identify that, because most physicians, 95% of them, have never been taught this in medical school. Even your OBGYN, even your family practice doctor that you trust, if your cholesterol level is high, they're going to want to put you on a statin drug instead of finding the root cause as to why your cholesterol level is high. Yeah. High blood pressure, they're going to want to put you on a drug. Can't sleep at night, they're going to give you some Ambien. Not feeling your chipper self, maybe you're depressed, let me give you an antidepressant. Got anxiety, let me give you an anti-anxiety medication. So in our culture today, there's a pill for every ill. They just want to put a drug Band-Aid on every symptom instead of really looking at what the root cause is as to why our bodies express with symptoms.
Yes.
That makes sense?
Yes, I agree too. Yes.
I can tell you, just to answer your question, women that are heading into menopause at some point, you've heard a lot of rumors about that estrogen causes breast cancer. It's not true. The medical literature and the medical data does not support that statement. Now, the imbalance of estrogen and progesterone can cause some things, but hormones, let's face it, I believe that the human body was divinely created, and the hormones that we make and produce in our bodies are supposed to be there, and they all have functions, and they need to be in balance. And what happens is, as we age, if they get missing and they go to very low levels, even though it may be normal for your age, this is the quintessential definition of optimal, we don't want to be normal for our age. We want to have the hormone levels that we had when we were 18 years old, when we were 17 years old, when everything felt good and everything worked good, our hormone levels were really, really high. And then as we've gone through our 20s and 30s and 40s, those hormone levels have come down and we just don't feel and function the way we did when we were young. And so if we can replace those hormones back to those optimal levels, guess what? The body responds to that, and we begin to feel and function like we did when we were a young, healthy, vibrant adult. So when you go in for your annual labs, they're going to run a series of tests, and it's usually a good listing. You're going to get a CBC, and you're going to get a full metabolic panel, and they're testing for enzymes and liver function, for elevated white blood cells, or a problem with your red blood cells, or mainly liver function and things like that. What you want to add on that is women definitely want to ask for a hormone panel. And what's not going to be included regularly is testing testosterone levels in women. So one of the top 5 things is you you really want to get your testosterone level checked. But what's going to happen is that the test is going to come back. Let's say you're a 35, 40-year-old woman. The range on a typical lab slip for testosterone in a female of that age is going to be somewhere between 2 and 45 is the numbers. And your number may be 10 or 20 or 15 or whatever. And so it's going to be within the normal range. Now, having done what I've done for the last 10 years and training practitioners and talking to tens of thousands of patients, we know that women feel good with a testosterone level up in the 100 to 150 range, or even a little bit. And they get their energy back, they get their enthusiasm back, their brain clarity and function, and everything just kind of wakes up in their body again. And then the second test that's critical is that free T3 test. Problem is, a lot of women might get resistance from the physician that's doing the lab slip to say it's unnecessary to test that test, and whatever insurance, may not want to pay for it. It's not an expensive test, and so a lot of times it's up to women to kind of demand these tests and say, I want my testosterone level checked, and I want my free T3 level checked, along with my TSH and my T4. I want a full thyroid panel done. And the other one that's in thyroid is your antibodies, thyroid antibodies. It's a TPO test, and this determines whether you have Hashimoto's. And Hashimoto's is a strange little issue with thyroid that would make you very sensitive to gluten foods and things like that. So just knowing that, whether you have Hashimoto's tendencies, would really inform what kind of a diet you should take. And so, eating pizza and a lot of bread, if you're Hashimoto's, is not a good thing unless it's completely gluten-free. So key things you need to know. You want to know your progesterone level. You want to know your D3 level. Okay, D3 is very important. And it's another one where the range on your lab slip is between 20 and 100. So it's a very wide range. The average American tests at 25, 30, 35, and it's completely normal. But I can tell you that the medical literature, the medical evidence over the last 10 years says that if your D3 level is below 50, you have a 50% increased risk of all types of cancer. And for women especially, you have a 6-fold increased risk of breast cancer. And I can tell you today that 1 in 7 or 8 women will be diagnosed with breast cancer in the American society. So if women would just do one thing and make sure that their D3 level is above 50, you automatically have a 50% reduced risk of any type of cancer and a 6-fold reduced risk of breast cancer, just by doing that one thing. And that's an oral supplement that you can get. The good dose on that is about 5,000 IU a day to 10,000 IU a day. But the typical doctor will prescribe maybe 2,000 or 1,000 IU, and truly that's an infant dose. For a healthy adult, you need at least 5,000 IU a day to maintain a level of D3 in your blood above 50. And that's a critical thing. It's for calcium absorption. In women, that's very important to prevent osteopenia and osteoporosis, which affects women a bit more than it does men, even though men are affected by that. This is just that one thing alone. So he asked me for 4 or 5 things: testosterone, thyroid, vitamin D3. You would want to get your B12 levels checked too. That's a simple blood test, and you can take some B12 supplements or get a B12 shot once in a while. They're not that expensive, but it gives you that natural energy. Again, these things help you feel good in your body so that you have more natural energy and less symptoms to make it through your day. And in the case of who we're talking to today, to be a better mom, to be a stronger mom to your children, and to, help you be more productive in the things that you're doing to earn the living that you're learning, understanding your health and how your body works and what you need to ask for. And in some cases, insurance can pay for some of these things. In some cases, it is a cash-based therapy that you might need to take care of. It just depends on how robust someone's insurance program is.
Thank you very much. I appreciate it. I appreciate your time. Anything else? Parting words?
Parting words is just that, look, an ounce of prevention is worth a pound of cure.
Amen.
And we've heard that, but we don't take that advice seriously sometimes. I can tell you that at the end of your life, maybe when you're 70, 80 years old, everybody that I talk to wishes that they would have taken better care of their body. better care of their physical being. We
Yes.
take care of our cars, we take care of our homes, we try to save some money for the future. We try to do those things, but we neglect our physical body. And I can tell you that without your health, you are truly bankrupt. Without your health, you wind up having nothing. And maintaining your health, educating yourself on how to maintain your health, and then forming the habits that are necessary, because it does require a change of habit.
Mm-hmm.
And I want to give one clue out there. The microwave is not your friend. I know that it saves time. I know that it's looked at a convenience item, but the microwave really kills the nutrition in our. And if we're already eating packaged and processed type foods and we put them in the microwave, we are truly destroying most of the nutrition that is in the food. So, solo moms with babies, please do not microwave the formula. Do not microwave the milk. Take a little extra time to put that on the stove and warm it up that way. I know it's inconvenient. You, as well as your children, need nutrition to live an optimal life. And that is one of the key things in our society that is truly affecting our nutrition, is microwaving things.
Thank you. Really appreciate you coming again and for spending so long and giving us so much information. And I look forward to talking to you.
Yeah, same thing. If you ever have another chance and you want more information on the subject, we'll see what your listeners have to say. If they appreciate it and want to hear more about it, I'd be happy to contribute to your show.
Thank you. Take care.
All right, take care. Thank
Bye.
you so much.
Bye-bye.